Right, good afternoon, everyone. So, thank you for joining us this afternoon. So we are going to chat about our nervous system, and this is always an exciting topic for me because it makes kind of sense to me, and it puts all the pieces together of what's happening kind of mentally and emotionally and physically, and we can discuss all of that. So for those of you that don't know me, I'm Bettina Moses. So I am a pelvic physio, and I have taught that for many years. So part of my brain is a slightly academic brain, and although I'm trying not to be too academic in today's discussion because this can be a very academic topic. But over the years, I think through patient care, I've really noticed that we encounter these problems in the body, and really when we look at resolving them, how do we begin to resolve these ailments or difficulties in the body when the picture's a little bit more complex? And that almost, and being in the pelvic area, the pelvis is a more complicated area of the body. And so what happens is that I found myself having to deal with, people's mental and emotional aspects. I had to look at the nervous system indirectly. And at the time, when I started practicing, this wasn't a very routine kind of way of looking at things. And it was more kind of a mind-body discussion, or it was classified more as holistic care. But over the years, what's been really exciting is that a lot of science has come out to actually scientifically and medically discuss the interrelationship between what's happening at the level of our mind and what's happening at the level of our body. So it actually in a very scientific way allows us now to really look at those areas. And I think why this is an important topic for me specifically is that it really, when you are empowered to look at the body, or the body mind complex in a more kind of integrative way, as understanding the nervous system, what happens is that you start to get empowered in what areas of the body or what methods of treatment are available, and what would aid a person and why that would be valuable. And you can really start to get a whole kind of basket of eggs together that can really help with the more chronic conditions. And that's where we started to find that I started to find myself getting improvement in my patient care. So over the years, I then went on to do a life coaching certificate. I'm also a TRE provider, which is tension and trauma release. And these are really just that really gave me just more permission to look from my kind of life coaching aspect, to look at more aspects of the mind or in the emotions and tools and that type of approach. And for other TRE is tension and trauma release. So it's a body, a somatic modality that regulates the nervous system. So I found almost that package to be very meaningful in the types of conditions that came in, and the kind of body concerns that my patients were coming in with. I have, over the more recent times, I've moved more away from the physiotherapy. So I'm not seeing too many patients at the moment, just because of personal choice, but I am involved more in the life coaching and the TRE. So that's where you'll often just notice I have a slightly different approach. But I wanted to just, before we go into anything else, I just want to introduce kind of my co-host, Hester van Aswegen. So Hester's with me in the practice, and we've worked together for many years. And I'm going to just let Hester introduce herself, and then we'll get started.
Hi, everybody. It's so nice to have all of you here. I am also a pelvic physiotherapist, and I work with Bettina. We've been working for many years together since our Donald Gordon days. And I now also see patients there at Bettina's rooms in Douglasdale twice a week. And yeah, Bettina, I think we're all looking forward to your talk this afternoon. It's definitely something that we see such a lot. and we can definitely all learn from what you're going to share with us. So we look forward to hearing what you've got to say.
Thank you. So, where do I start with a topic like this? So this is one of the challenges with a topic like this, because first of all, we have so many names under which it goes. So a lot of people don't understand when you say you're talking about the nervous system. It's like, what is the nervous system? Other people will, if you say mind body, it seems like it's more holistic or out of the medical side, and that can also become fearful because you almost are not sure where this all fits in. But what I'd like to do is that I'd like to just give you a brief overview, because it's a extensive topic, and I really just wanted to be practical. I'd like you to walk away with today with the understanding of how the body interrelates and where these interrelationships come in. Some of it may be a little bit technical in scientific or medical, but it just will really give you a really good understanding. And hopefully by the end of it, you'll be able to, there must have been a reason why you're here. So there must be either a interest for you in it, or you are struggling with something. You have a chronic kind of dis-ease in the body that you're looking at, or you're feeling overwhelmed on an emotional level, and all of these are actually not separable. And this is one of the kind of difficulties in that conventional medical model, and this is why this is such profound research that is coming out and science that is coming out, because it's really validating that we can't just look at either this part or that part. And it's almost like that old medical model cut us off at the neck, that anything up here that was emotional was for the psychologist to deal with. Anything below that was physical, and you went to the doctor or the physio or the person that dealt with the body. And really, when we're looking at the nervous system, our nervous system is kind of our brain and spinal cord, and all the nerves, and the relationship between what's happening like chemically, what happens when you get stressed, what happens when you what different nervous system states there are, and what happens in the actual brain at that time is that there's a release of a variety of chemicals, and those chemicals go into your bloodstream, and there's a reaction through the spine and the actual nerves, which goes into the body, and suddenly what happens is you have a body experience. So we cannot say that an emotion, even in isolation, is a mental or a mind experience, or an experience up here, because it's not. It's an integrated experience within the body, and the body will pattern in a certain way. It will tense in a certain way. It will program in a certain way. It will release certain chemicals and neurotransmitters that will cause certain body systems to activate, certain systems to shut down. And in so doing, which is all part of our normal survival mechanism. So this is a wonderful kind of survival component to our survival. But when we sit with long-term, for instance, let's say long-term stress or long-term nervous system dysregulation, that can become a whole nother kind of issue to look at, because now suddenly certain systems have been shut down for years and years and years, and that can cause certain dysfunctions within the body, certain disease in the body. Disease and dis-ease. Okay, so some actually can cause diseases. So certain of our chronic diseases are very nervous system based, in the sense that their primary origin, when they look at it, is actually based on a nervous system dysregulation. So, and we'll look at that, and that becomes quite interesting, because when we're looking at things like diabetes, for instance, is an example of a chronic inflammatory problem. Chronic inflammation is related to a nervous system dysregulation. Yet when we treat diabetes, do we ever look at the nervous system? And this is kind of where our mismatches come in. And when we're looking at a well-functioning nervous system, we really are looking at our health and our well-being and our vitality, and that's where we thrive versus survive. Okay, and yes, we can correct one thing here or one thing there, but when we can get the system functioning well, um, that is when we actually start to access our vital life force. We are energetic, we are alive, we think clearly, we can function well, and we are healthy by the nature of that. So that's really where this becomes just such a empowering. It's so empowering to have this type of information, because you can start to, your decision making around your well-being may change once you have a broader picture, or it will start to make sense to you why certain physical conditions are related with certain emotional patterns, and so on and so forth. One example, for instance, is, and we'll go through a couple of these as we go along, but just from kind of a bit of an introduction, like for instance, irritable bowel syndrome is very nervous system regulated. It's related to the vagus nerve, and that's often related to stress. So the stress can dysregulate the nervous system. When the nervous system is dysregulated, you are stressed. The gut won't function well. So when we're looking at, for instance, how do we manage irritable bowel syndrome, we may want to start thinking about that. And often, we're confronted with a situation where a patient, for instance, has come in and they're offended that the doctor has asked them to go and see a psychologist, to go and see somebody to manage their stress levels. But actually, in truth, you cannot manage the one without the other, because the minute you're stressed up here, you have to release neurotransmitters, because the brain, the mind does not know whether that stress is something, it's a very primal reptilian nervous system. The sympathetic, we'll discuss that, is a very primal, and it's there to keep us safe. So it doesn't know whether we're worrying about the lion that's actually going to eat us, or the financial stress, or COVID, or or just a kind of day-to-day concern because a friend has upset us. So it doesn't have that almost intellect at that level. And whatever we feed it, it will respond to that, whether it's real or imaginary. And that becomes a real minefield when we're looking at our health and our well-being, especially when we are at the point where it has created a physical reality, that we do have a condition or a disease or a dysfunction that's actually presenting itself. So I'm going to just show you one or two pictures to just, so first what we're going to do is just have a look at the different types. So this is done by a man called Stephen Porges, and different researchers and different people look at the nervous system in a different way. So he specifically looks at it from a behavioral and physiological perspective, which for me is always the interesting side, because all these years I've worked with people's physiology, their body. Now I tend to work with a combination of that, but we basically have three nervous system states, to simplify things: the calm, the relaxed nervous system, the parasympathetic system. He calls this social engagement nervous system. So this is really when we're relaxed, we're in joy, we're present, we're grounded, we're curious, we're open. This is a space where we can learn, we can take in information, we are creative. We have connection. So the nervous system doesn't only talk to how our body functions, but it also talks to how we engage. And that becomes a very interesting thing, especially when you're looking at children and that, but that's a whole nother another discussion that if some of you are interested, we can go into. But really, when we calm, when we're relaxed, when our parasympathetic nervous system is engaged, and our vagus nerve, so some of you might have heard some discussions around the vagus nerve. The vagus nerve is our primary parasympathetic nerve. So but when we when we are in that state, it's almost like that is us being in our cave. Okay, that's where we can connect. Oxytocin is released, which some of you might know is the hormone for breastfeeding. So it's a connection hormone. We feel relaxed, we feel open, we can make eye contact, our features are softened, our voice is calm, and so that's kind of more our social and our behavioral aspects. But on a mental level, we're relaxed, we're calm, we can learn, we're creative. On a physical level, this is the kind of space, in the cave, we digest, we eat, we digest, we pee, poo, and have sex. So for us in the pelvis, that is a critical nervous system state for functioning of the pelvic area. It also is the nervous system state that allows for regeneration, rejuvenation. This is where our immune system, where our resistance to infection is built up. And really, it's a critical aspect of our well-being. And we ideally should be spending about 80% of our time in our calm or parasympathetic nervous system. So we should be kind of, as we were in the kind of cave days, we would go back into our cave, we would go out for the hunt once a week or twice a week, and then you'd come back to that and you'd be safe and you'd be relaxed, and the body could replenish itself. So from here, the next step up, so let's say there is a threat, okay? The system moves into what we call a sympathetic nervous system. Now, this is a primal survival nervous system. So if we didn't have this, we would not be able to survive because it's there to keep us safe. So as much as we maybe in a discussion like this, when we're talking about ill health or certain emotions, we almost don't want to label it as the baddie because it has a very pertinent role in our survival. And if we didn't have this, we wouldn't make it. But the problem is that the balance is off. Okay, we're not spending 20% of the time here, we're spending 95% of the time here. But in our sympathetic nervous system, that's where the brain perceives a threat. Our senses perk up. We anticipate, and this really is prior to any higher cortical function. So this is the reptilian brain. It works outside of the realms of cognitive thinking. So it's not necessarily oh, that's interesting, I heard a noise, I wonder what that is, and this delayed thinking process. No, it's instant. It's literally like, what was that? Okay. And before you've even mentally processed anything or even asked a question, that nervous system has already kicked in. Okay. And based on the response that it's reacting to, it basically takes one of three pathways. Either it's I'm going to run, so the flight response, I'm going to fight, or I'm going to freeze. And all of these, again, are protective mechanisms. And with each one, there is a slightly different response that happens both mentally, in our behaviors, emotionally, and physiologically. So the kind of flight or fear responses are more kind of the panic, the anxiety, the worry, the concern. The fight is the anger, the rage, the irritability, the frustration. And in these sympathetic nervous system states, it shunts blood away from the central organs, which are responsible for digestion and kind of repair and rejuvenation and fighting infection, to I need to fight, I need to run. So it's muscle tension, your blood pressure goes up, heart rate goes up. Your field resources are used in a different way. You use a lot of energy for this. So, and it will shut down those other areas. So all of the areas that are active in our calm nervous system will be shut down because they are almost not essential in they're not going to keep you alive. So it's like, we don't need to digest food, we don't need to eat now, we don't need to pee now, we don't need to do all of that now. We need to fight, we need to run. um, so that's the sympathetic nervous system. That's where we're releasing adrenaline, we're releasing cortisol, noradrenaline. So those are the neurotransmitters that are released in the brain, and the minute that release happens, it goes into your bloodstream and your body will pattern accordingly. So the sympathetic nervous system is still quite an active state. So you kind of, it's a hyperarousal state. So you're alert, you active, you can do things out of the norm that you didn't even think possible. So it's a very active state. Should the nervous system go into deeper threat, it may kind of, and again, this is not within higher cortical thinking. So, and this is, for instance, like a car accident. Okay, so initially you might alert up, you can put on brakes or whatever, but the minute the nervous system almost, and they call it like neuroception. So it's almost like the nervous system has an ability to intercept with its environment, to like almost read the environment, and it makes the decision, not you up here makes the decision. It's such, it's such split seconds. But what happens in this situation is that the system goes into a shutdown. And that's, a car accident is a typical example where people will describe and say, oh, I have no memory of it, or I can only remember up to a certain point, or I could see myself going into it, but I wasn't quite in my body. And it's a wonderful, wonderful protective mechanism to keep you alive. So really what happens is that you go into a dissociation. So you actually kind of step away from yourself. You go into numbness, like a shutdown response. If you have had deep trauma, for instance, then and this state lasts for longer, these are the state, this free state is where we can feel very burnt out, very exhausted. There's helplessness, hopelessness, this trapped feeling, this the suicidal feeling, the real shutdown states, the addictive states of not really feeling that you can get out of this. So alcoholism or something like that would fall into this, where there's just a complete shutdown. So there is an almost difference between what's happening in the moment, like in the car accident, and the long-term effects of it. So in the moment, in a trauma situation like a hijacking or something like that, ideally it's short-lived. So the system reacts, it does its best to choose the correct response, and then it kind of goes up the loop, like up this roller coaster. And then ideally, when the situation, on the other side, it'll come down again, and a healthy nervous system will come back down and it'll regulate down back into a calm state over a period of time. So there's an activation process and then there's a deactivation process. The problem comes in is that if, for instance, you have activated and then you don't know how to, or the body doesn't know how to, or you're not aware of the fact that you still almost, for those of you that know me, I always use the analogy of hanging upside down in the loop of the roller coaster. So sometimes we're hanging somewhere here and we don't actually realize that we're looping and looping around in the sympathetic system or in the free system, and we're not actually able to come down and down and down and down and come back into a form of regulation. And that's where the problem comes in. So riding this loop is not the problem. The problem is when the nervous system isn't able to actually regulate itself, or there is ongoing stress, long-term stress. And what happens is that all these neurotransmitters are constantly being released, and we're not actually getting time to relax, to settle down, to sleep again, to rejuvenate, to regenerate, to heal, to um, build new cells for like wound healing or something like that, for a body healing process to happen, for digestion, for for the immune system to recover again. And that's really where we find ourselves in these looping spirals of our nervous system. And the nervous system may present itself as a physical thing. So you may have one of the physical manifestations of it. So in other words, you may have palpitations all the time from the sympathetic fight and flight response, or you may feel a lot very shut down and disconnected from the world, from a free state. Or you may feel an emotional response where you're actually feeling just this depression or this anxiety, or anger, rage, that you're struggling with. So a lot of the time, I think what people are not realizing is that it may be it may be either an emotional state or a physical state that draws your attention to the fact that, hang on, there might be something happening in my nervous system here and actually by looking at that specifically, it will cue you on which way is up. So yeah, so that's really in a nutshell what the nervous system's function is, and how it almost interplays in a normal kind of, in our lives, in a normal day, and it's all doing doing it perfectly. It's just that our lives are sometimes really crazy. So I think I'm just going to go on to one other pick, and then I'm going to take a few questions. So if you have any questions based on what I'm discussing now, pose them to Hester in the Q&As, please. And Hester will pick them up, and I'll stop here and there, and we can address it. It's always nice so your questions are anonymous, so please don't worry about that. We don't mention names or anything. But it's always nice to put it into context, to put it into a real life scenario, because that's when you can really see how to apply it and how this works. But what I wanted to show you is just really where, for instance, so this is our parasympathetic innervation. And this looks like a bit of a technical slide, but what really I wanted to show you with this is that you can actually see the entire body is being affected, or has parasympathetic innervation, which is your calm nervous system. So your calm nervous system has effects on your eyes, in your sight, in your salivary glands, and you'll notice instantly that when you get stressed, what happens? You get a dry mouth, okay? Your heart. So when the sympathetic state kicks in, what happens? Your heart rate increases, your breathing changes. So it affects your lungs, it affects your whole gut, and your the liver, the gallbladder, the stomach, the spleen, the pancreas, and those are essential organs of digestion, because they are secreting your digestive enzymes, and in the right balance at the right time. And if that's not in order, how can we even expect the digestive system to work? What are we, these are the types of questions I used to ask myself, like, what am I actually doing? Trying to get a, someone's constipation right, if the building blocks of how the system, our systems are these amazing machines. They know how to work. But when you fiddle with them, that's where the problem comes in. But they, our bodies are just amazing operating systems, and they know how to work. So how do we begin to start resolving something down here that where the building blocks are not in place? So this is kind of where I was always, challenging. And for those of you that have seen me will know that I'm always kind of going into different boxes and asking different questions, and how you're feeling and how you're dealing with that aspect of your life. And can we look at that a little bit more specifically? Because I realized that if I'm not getting equilibrium or homeostasis back into the nervous system, how am I ever going to get someone's IBS, functioning better, or their gut functioning better? So, um, and you can see how the parasympathetic nervous system really goes through the entire body: the kidney, the bladder, scrotum, penis, ovary, uterus. So here you're looking at your sexual organs, you're looking at what's happening down in the pelvis. Um, um, you're looking at your hormonal system. So, for instance, kind of, your like your sexual hormones, your testosterone, your fertility hormones. So, when we're talking about things like fertility, they talk about the stress and pregnancy or not falling pregnant, but here is the link. This is why this stuff's happening. If we're looking at sexual function or libido, this is where, if your nervous system, if you're not in the cave, you're not aligned, like neurochemically and neurophysiologically, you're not aligned with that. The body's going, no, if I do that, I'm going to die. There's a line that's chasing me. So it cannot switch on. So this is where we have to think. If we really want the body to function, we've got to switch the right things on at the right time. And it sounds all very easy. It is. It's very difficult, but at least having the understanding of how things fit together, I think, is very empowering when we're looking at these types of situations. And if we just, I'm going to just share one more pick with you, and then we will take a few questions. But you can see here this, so the vagus nerve, as I mentioned, is your parasympathetic, your calm nerve. So it affects your heart, so it decreases your heart rate and your vascular tone, so it calms you down, it regulates your insulin, and it creates glucose homeostasis. So this is kind of the whole diabetic diagnosis and the digestion, the gut, your gastric juices, your gut motility, your stomach acidity. Inflammation. Now, inflammation is a massive, massive, massive topic, both in a COVID discussion, because, that's the one thing about COVID, is that it causes a huge inflammatory reaction. But a lot of our chronic conditions are inflammatory based. So we mentioned diabetes as being inflammatory based. Alzheimer's, our autoimmune conditions, our arthritic conditions, and that's only kind of the more diagnosed condition, but things like pain and chronic pain. So when we're looking at pain, and this is one of, again, what I was observing in clinical practice, and is that, I would release someone's neck or release someone's back, and it would be okay for a little bit, and then it would come back again. And it's because internally the system's driving kind of a certain way. And, this becomes challenging when we are, looking at a physiological condition, when there is almost an ongoing inflammatory activation by the nature of the nervous system state that the person's in. So cortisol is responsible for inflammation. So that's part of the fight and flight responses. And so, and not only does it increase muscle tension, but it increases inflammation. So when we're looking at healing from any physical injury or pain is one thing, an operation or something like that, it doesn't serve us very well neurophysiologically to be under stress. We need calm environments. Cancer is another inflammatory condition. So yeah, there's a lot to think about. It's very interesting. So the vagus nerve also is a part of the kind of in the brain, and anxiety, depressions, orally, our taste, our gag reflexes, swallowing, coughing, all of that is regulated by the vagus nerve. And you'll see that's why sometimes there can be a nervous response in the oral kind of area where someone will, be clearing, or, there can be a nervous state that shows up there. And in your blood vessels, so blood pressures and that. So you can really see how extensive, this whole system kind of intertwines. How did my video go off? There we go. How everything intertwines and interconnects and interrelates. And I think this is really, really, really the key to our kind of well-being and management of these kind of of this. So yeah, let's Hester, I don't know if you have any questions so far, or if you have any comments or anything that we
I
can.
think, Bettina, it is so important. You've already mentioned that so many of our patients come into the room, and then their problem, they might be constipated, they might have IBS, they might have a lot of pain, but behind all of this is this nervous system dysregulation that is happening. And I think it often takes me a whole session just to explain to people why we need to focus so much on this, because if this is not in place, we're going to struggle to get the other things to be better. And I think it really is important for people to actually understand that. You've said it, that so often people can be upset if the doctor insists that they actually see a counselor or a psychologist, because the stress management of their condition is as important as the actual physical management. If we cannot get everything to be in harmony and function together, we're not going to get somebody optimally better.
Yeah, exactly. And I think that is, these are the challenges that we faced, because let's just be honest, if you have a ailment in your body and you're not feeling well, then how can you emotionally really feel well? How can you easily say, I'm not going to stress about my cancer? Like, seriously, is that, and this is the thing, but the anxiety and the stress about the physical can actually just almost be that almost snowball effect that doesn't allow the system to optimally heal, regenerate, rejuvenate, develop new cells, heal, and all of that. And I think what's important is that when we look at the vagus nerve, for instance, the vagus nerve is like this highway, this like super highway. And when I say highway, it's a two-way street. It's not just input coming from up here going down into the body. But the thing with the vagus nerve is it also interprets the body and sends information back up. And sorry about that. So what happens is that not only is what we are experiencing up here in our kind of mental and emotional perceptual realm affecting our body, but with the vagus nerve, 20% is down and 80% is up. So actually, for every 20% of what's kind of filtering from here down, 80% is what's filtering up. So what I mean by that is that, let's say you are not feeling well. the stream of information going up, ongoing, is bombarding to the mental and emotional realms, going, and it's a safety mechanism where the system's trying to say, hang on, there's something not right here, something's not right here, something's not right here. But we don't understand that. So it becomes this vicious loop, and it's this chicken and egg of where do we start, So yes, our stress causes physical reactions or dysfunction. Our physical or lack of feeling well feeds back up and causes, once again, a disease. We're not relaxed in that state. And so it really is this two-way street ongoing. And I think this is where, how can we separate the two? How can we only address one thing? And you will notice that if you're a person that struggles with, on the emotional side, if you are anxious, if you're depressed, if you're a worrier by nature, if you get very angry and you struggle with your anger or your irritability, it's highly unlikely that you don't have, and if you don't have, not yet, some or other physical something happening in your body. And you may not necessarily link the two, but where do we have stomach ulcers in stress, or acidity issues, heartburn? It's because our neurophysiology is out. We're releasing fight and flight responses, and we're creating stomach acidity. Or so if we're having an emotional response, we're inevitably having some physiological reaction, be it muscle tension, be it a sore neck, a sore back, some digestion issues, some cramping, some joint pain, some possibly nausea, and predisposing ourselves to the more chronic inflammatory type of conditions that can arise from a long-standing nervous system dysregulation. On the flip side, if you have a physical condition, how can you not be anxious or worried about it or frustrated with it? Or so I think this is where we need to just call a spade and say we can't look at the one without the other and think that we're going to really have optimal function. A pill that addresses your stomach acidity, let's say, doesn't, or that removes an anti-inflammatory or whatever, is not changing what has caused that necessarily. So yeah.
Tina, there's been a question of one of the participants asking, how do you manage inflammation?
Okay, I'm going to come back to that. So I'm gonna have a chat to you a little bit about what causes this, and then the type of treatments, and then just keep that in mind. We'll come back to it at the end, because it's going to be a culmination of a couple of different things, but again, it's called nervous system regulation under the big umbrella of that. And then what we need to do is we need to tweak kind of more specifically what individualize that. So it's not a prescriptive formula, but the umbrella of it is one of the things that you want to do if you are struggling with chronic inflammation or inflammation is regulate the nervous system. And I'm going to discuss how we do that.
Okay. Somebody just commented to say that she's having TRE therapy for trauma release, and it's really, really helping her. And I think you referred to that previously as well, as how much that can really be of benefit to try and help regulate one's nervous system and bring you into that calmer state.
So this is where I'm going to discuss with you how the different approaches. So again, it's a vast topic, and it's there are many roads to Rome in this, and partly it depends on what you're struggling with. Is it more mental? Is it more emotional? Is it more physiological? Your personality, your belief systems, your culture, various things will play a role, but the umbrella of it is we want to regulate your nervous system. How you do that, again, there are many roads to Rome, and we'll discuss that. All right. Should we continue, or is there?
Can I maybe just add this? I think this is what you are going to be discussing, but just that you know that there is a question where somebody's wanting to know how you can engage the parasympathetic system. They'd like some practical tips. They know about breathing, but maybe to know about a couple of other things. So that was one question. And then somebody also saying that she often gets mouth and tongue ulcers that coincides with her ovulation and menstruation times. And could there be a central nervous system response there as well?
Interesting. I love the questions. Thank you. Okay, because what happens is that it allows me, as I'm chatting to you, to really bring in the things that are meaningful for you. But let's so yes, I do think that there is likely to be a correlation between the two. Exactly where it links up is hard to say without a deeper history, and sometimes it's not even necessary. I would, if you have any thoughts that it could be interrelated, inflammatory responses are inflammatory responses, calming the system down and picking up the immune system, and all of that can be very beneficial. So there's one more picture that I'd like to kind of just show you, and that is, so again, there are many fancy words that we use discussing mind body, or we're playing with words really, and I think this is an important part of the discussion as well, is that very often people are offended when we use specific words or don't understand something or can't find the correlation in the terminology that is used, because everyone's throwing out slightly different terminology. Then it's integrative, then it's holistic, then it's mind body, then it's neurochemistry, then it's psychoneuroimmunology, then it's all the same thing. Or when we talk about even nervous system, a lot of people say, but I don't even know what you mean by that. Okay, so what we mean by your nervous system is your psychoneuroimmunology. So it's kind of like your psychology, your neurology, and what's happening. So this is one field where they're looking specifically at your immune system, and really how all of these things fit together in a framework of how our emotions, our neurotransmitters, and our immune system, and ultimately our body well-being comes together. And you can see that there can be a stressor here, and it's going to kind of affect one or other of the systems, So the stressor might not be an emotional one today. It can be a virus, and the immune system will trigger, and it can flood into the other systems, or we are more our immune systems will be lower when our nervous system is too activated, when there is anxiety and there is depression. And you will notice that when you are very anxious or when you're very stressed, what is the first thing that happens? You get sick. And the other thing that it links with the immune system, and it links with your endocrine system. Okay, and the immune system and your your inflammation ties in with your immune system. So that's where the infections, the allergies, pain, inflammation, all kind of fit together and work with the immune system. And your endocrine system is your hormonal system, so your thyroids, your adrenal glands, so this is where your burnouts come in, and the gonads, so your sexual hormones, both kind of male and female, pregnancies, periods, sexual function. So, and that's where your autoimmune conditions come in. So you can really see how suddenly everything's starting to fit together, which, being in practice, I could see that I could just see that we were never going to kind of get to where we wanted to be by just focusing on that one aspect or that one aspect. And often, like, what would happen is that in clinical kind of care, they were done separately. So like the counseling or the mental and emotional well-being was done separately to the physical, or at a separate time to the physical um, treatment or whatever, and they kind of all fit together, and often just putting all the things together at the same time sometimes would give the result. So people would have gone to the dietitian, they would have gone to see the psychologist, or saw this person and that person, but separately, or one after the other, when actually it needs to be done all together, that the system can just go, phew, okay, I can heal now. So let's just go on to looking at, so what can cause this? So the main kind of, I'm not talking here about the kind of just the odd situation where you need your nervous system to spike up and react and keep you safe. Okay, this is not really that is part of normal functioning. You'll spike up and you'll come down again. These are not things that are going to cause chronic conditions or cause malfunction in the system. You're designed like that. You're designed to survive because of that. But where this problem comes in is things like long-standing stresses, long histories of very stressful situations, war zones, things like that. They track it back to, they've done a lot of research on what they call ACEs, which is adverse childhood environments. They've noticed that, and what basically, where this all goes to is there is an early nervous system dysregulation that has happened, and almost kind of the system hasn't been able to kind of come back into a homeostatic space, into homeostasis, into equilibrium again. So a stress or a trauma is not the problem, okay? The problem is the system coming back down? Is it regulating again? Or is it still kind of halfway up the curve or down the other side? And then the next one's heading and the next one's heading, and the system kind of goes up and ramps up a bit more and ramps up a bit more, and it never really comes down, okay? So the stress or trauma is not the issue. It's how has your nervous system responded to that, and what has happened afterwards that one that can cause these types of things. So they've done a lot of work, which for me is quite interesting, kind of in my life coaching brain. A lot of they've noticed that very if your mother had a very stressful pregnancy, so already in utero stress, and we don't really ever consider that. And this was quite fascinating for me after having had one or two of my patients or clients over the years, having had like hypnotherapy or hypnosis, and stuff's come up, and it's like, and the physical body completely changed, and it's like, wow, like, how does that work? And this is how it works. So really, and as children, we have a very immature, or we quite primal in that regard, and we tag on to our environment, and this is a very animalistic thing. It's a safety mechanism. So in a herd, the minute, and it's based on that, what we call that neuroception. So it's beyond our thinking. It's quite primal and instinctual and intuitive in a way, and it's almost like you'll see kind of the in the wild, the minute the elders perk up their attention, the young do, okay? Because if that doesn't happen and they're not in that fight and flight response and there is a predator, they're going to be playing around, and it's a survival thing. They then become the weakest link. So as children, if we are in utero, we are riding both in what's floating around in kind of the amniotic fluid, but also we are living through those kind of neurological or nervous system reactions of the parent. And also as children, when we are in stressful environments, and this is something where often I am the person that, and even kind of in a physio role, for those of you that have seen me, I will usually ask about my patients or clients' childhood, even if it's not a kind of life coaching session. But the thing with it is that it was interesting for me because often what's happening in our childhood and how stressful that environment was can almost set the space for a nervous system dysregulation. And then how do you start to solve something 30, 40, 50 years down the line in the physical body when the nervous system has never learned? How did that 2 or 3, 4, 5-year-old learn to regulate? They didn't learn to regulate, and most of the time the parents didn't know what regulated meant, so they never really learned that. And that's what we call co-regulation. So if you ever read stuff around co-regulation, we co-regulate with each other, and that can serve us and it can fail us. But as children, if we have parents so sometimes it can be a what they call an ACE, an adverse childhood environment or situation that arises. And other time they call it developmental trauma. So it's just kind of, you have a mother with anxiety and she's always stressed, or they're long-standing, or there's alcoholism in a parent, or a parent that a poor relationship. It doesn't have to be terrible, but it means maybe that as a child you always had to be perked up, like you always had to be a little bit more alert. You could never really just totally relax because you didn't know how dad would be when he came home from work. Would he be relaxed? Would he be angry? Would he shout at you that you didn't tidy your room up well enough? Were you shamed with? So it can just be environments that don't where the child, the experience, so it's not what has happened, but it's more the experience of it. And a relaxed, calm nervous system is a nervous system that feels safe. So if we don't feel safe, we don't relax into our cave. So we can be in the cave, but if the cave is not relaxed, the nervous system cannot come down into that parasympathetic state. The vagus nerve doesn't tone. There's no vagal tone. There's no activation of the vagus nerve. So that's more kind of on the mental and emotional side. But other things can also affect our nervous system. So things like a poor diet. And if we're talking about an inflammatory discussion, a lot of our foods are very inflammatory, processed, and cause a lot of inflammation in the system. So that can agitate the nervous system, not from an emotional, but actually from what we're consuming and putting in. A lot of our foods or have a lot of pesticides and chemicals and toxins, things like alcohol or smoking, or all of these, caffeine, have effects on our nervous system. So and that's why we go to smoking or alcohol for a nervous system response. We are stressed, so we'll have a glass of wine, or so that can also cause some nervous system dysregulation. And and kind of the things like screen time, lighting, Wi-Fi, all of that stuff in our environment has also been proven to cause nervous system dysregulation. So there's a lot of research that's come out around sleep, issues with sleep and cell phones and lighting and the type of lighting and the Wi-Fi. Sort of, for instance, if you're in a kind of apartment building with many apartments, a lot of technology or Wi-Fi, they've found that it can disrupt sleeping patterns. And if you're not sleeping, you're not coming into that calm system. You're not building your immunity. You're not giving the body an opportunity to cope with it, to process the inflammation, the healing, the whatever. So those are the types of things that can affect your nervous system. And again, it becomes a chicken and egg thing. Where do we start? And really, this becomes again, it's a personal thing. Each person needs to look at their specific environments for that. To see where your triggers are. Where is your nervous system dysregulation? Are you on a cell phone for 10 hours a day? Then try to take screen time breaks. If you're working on a computer, like for me, I'm not used to, just by the nature of the work that we've done for years and years, we are not computer people. And I noticed the change of almost shifting into more screen time or more online or, this type of thing. And I noticed after a certain period, I needed a time out because my system was getting very agitated. And then it was an abnormal agitation that was unfamiliar to me. I thought, this feels strange, and it, for me, I know that screen time affects me. So I don't know, Hester, if I should just carry on and we discuss a little bit of treatment, or is there anything you want to comment on, or if there are any questions at this stage? Sorry, you're muted.
Apologies. There is one or two questions, but I think you are probably going to touch on some of that in the discussion of the treatment. So maybe I think you can do that first, and then we can come back to if there's specific things that you haven't covered. But yeah, you were just saying now that people, I think, are often not in touch with what they are feeling and what they are experiencing. And that is part of the problem, that you don't realize how much the fact that you might be busy with technology 8 hours a day, or that you're just worrying about stuff all day long, and then on top of that, maybe not eating properly because you're always in a hurry, so you're skipping meals, or you are grabbing something just on the go and it's not proper food but just a takeaway, and then probably being anxious and not being able to sleep well at night. So it's all these little things that just add up, and in the end you really struggle. For our bodies to function well, we need to look at every little aspect to try and improve our situation and really down-regulate our system where we are in that more calmer state.
So Hester, you have just painted the picture of chronic inflammation. So that's the answer to chronic inflammation. And it's multifaceted. And I think it feels overwhelming to go, but wow, I just, I need to eat properly. I need to relax. I need to this. I need to that. Like, how can I do this? And it's incremental changes. It's just kind of switching, putting the volume down a little bit and a little bit in many departments that I have personally, I've for many, many, many years done my own personal kind of journeys and work on physical and emotional and on various aspects. And really, if I can say that a little bit in different areas, you don't have to have a perfect diet, but just small adjustments. You don't have to whatever, it's just little adjustments in many different areas, and the whole system goes, oh, I feel better. Okay. And when you feel better, you are more inspired. You've got more energy to make the next little change and the next little change and the next little change. Because really, when you're exhausted, to start telling someone that they must eat a well-balanced meal, and, I know it's like, when we were kind of seeing like, well, you are doing that. I'm kind of breaking to fetch kids and things like that. But, when I was working a full day, really, if someone had to start telling me that I must, like, stop and sit down and mindfully eat, I say, honestly, like, you're kidding me. And this is the thing, is that I say this with full knowing, having walked the road of trying to and working on regulating my nervous system. And it does, and really it is just incremental shifts, and it's about doing it in a clever way. It's combining things, and what I'm going to discuss is just an overview of different treatment ideas as kind of an umbrella of how to regulate nervous systems. Maybe we can have a follow on to this, where we could maybe look at maybe a discussion around how a normal daily routine could look, or so if there is interest or stuff, let us know, and kind of versus, because it's not going to be tick, I've done TRE. That those few minutes for the rest of the week, that's completely thrown, where your nervous system is being completely thrown off. Like, yes, it helps, but that's not going to just be this magic formula. One needs to almost deal with cause and effect. So it might be something that would be meaningful. If you do feel that's meaningful, then pop it in and let us know if it's meaningful to kind of have a follow on as I go along. You don't have to do that now, or if you're watching it on recorded, then you can always drop me you can go onto the website. I'll give you the details later. Maybe just drop me a mail or something, and it's important for me to know what are the types of things that you're needing help with, because then I can structure these discussions around that, versus making them, we can have more, or we can be more specific, and whereas at the moment I'm just trying to give you overviews. Okay. But also, I think what's really important is we need to empower ourselves, especially at a time like this. We want to be staying away from hospitals. We want to be staying away from environments like this, kind of just where we are in the world with everything that's happening. And we want to really be empowering ourselves to start to manage our own well-being. So when we're looking at, and I use the word nervous system regulation as a kind of umbrella word. Now that I think all of you here understand what I mean by that. We have two almost strategies in management of regulating nervous systems. We have what we call a top-down strategy, and we have what we call a bottom-up strategy. And what this means really is that that we want to realize that this kind of highway, this two-way street, is up and down. Okay, so you are not so sometimes people will say to me, but I've been for counseling and it hasn't helped me with my anxiety, or it's helped me up to a point and then no more. Okay. That, for instance, is a top-down strategy. So top-down strategy is where we're looking at the focus being here. So things like top-down strategies are counseling, cognitive behavioral therapy, introspection, looking at emotions, or developing coping skills around managing our emotions, managing our environments, managing. So they're kind of more mental and emotional strategies, introspection. What also falls under this is, for instance, things like mindfulness, visualization. So if we can aid ourselves in quietening here and managing our triggers. So a trigger is where we have a reactive response to a situation where the whole system goes or upregulates. which is what it's supposed to do if I'm going to be attacked or eaten. But suddenly someone walks through the door, or your child has, left something, for me, the famous one is the luminous putty stuck in the carpet after you've told them to pack it away 5 times. That's a trigger. And that, so it's all of it's managing things up here, okay? And very often that there is value in looking at kind of inner child work, or specific very traumatic situations or periods in our lives where the roller coaster may have gone up in that time, and you kind of never unlodged from that. So for instance, a death, a divorce, a, a specific car accident, okay, that can also be physical, not necessarily emotional. But really, what the top-down strategies are about, looking at managing things from this space in the attempt to calm the mind down, to say, you're okay, you're safe, it's okay, nothing's happened, it's putty on the carpet, it's okay. No one's died, nothing's happened, okay? And it's about learning how to come back into that, it's okay. And what happens in that okayness, that I am safe, nothing's happening here. And yeah, so coming back into that safety, that almost changes those neurotransmitters again, going, no, switch off, switch off, switch off. We don't need to go into this whole adrenaline cortisol response, okay? We can start releasing some oxytocin. We can carry on digesting our food. We can go and we can, carry on healing different areas of the body. Everything's fine. So it's about learning how to manage that. And especially if we are in we have a stressful world situation, we have stressful circumstances often, there can be financial stress, there can be factors that are not easily changeable. We can't just kind of make certain things go away. We have to learn to manage them. And by learning how to regulate that system through various processes, like mindfulness, like meditation, prayer, and I use meditation lightly as in a calming of the mental and emotional state. Prayer can do that. Just mindfulness in the things that we do and how we do them, slowing down a little bit, okay? It can be things like journaling, talking, crying, sharing, expressing old trapped emotions, and very often I don't necessarily believe that ongoing talking about old problems is the solution to this, no. But if the roller coaster is unhooked, that we may want to unhook, it's stuck there, we may want to unhook it, and then we must come back to the now, because this is playing out now. Us constantly talking about all these stressful things can dysregulate the nervous system too. So this is one of the problems, is that sometimes the mind is stuck in past stories that are going on repeat, and we don't know how to switch it off. And we may need to learn how to do that. But, so those are the top-down strategies. And, this is where my kind of, that's the reason why I moved into the more life coaching. That's where I found that hut meaningful almost for me, is that I could aid people in tools and abilities to manage things from that aspect, to start to downregulate the system. But personally, I don't think that's enough. Okay. And I think it's because of that two-way street, that up and down, is that we are working on the going down now, But that's 20%. We've got a whole 80% that streams up all the time from our environment and our body and our experiences that trigger the mind or set it off into a cascade of dysregulation. So we call those bottom-up strategies or somatic modalities, somatic meaning the body. So our aim or our intention of some of our somatic modalities is nervous system regulation. So TRE, for instance, is a somatic, a body modality that aids in the body's ability to regulate itself. So that specifically works on, so in our normal kind of nervous system response system, so like let's say when you come out of that car accident, you'll notice that you're shaking. And that almost physiological tremor, as they call it, is the body. So you've had this huge rush of adrenaline and cortisol and everything flooding to your system, and you didn't have a chase, or you didn't have to run it off, or it's all floating around. What the body does is it actually shakes, it tremors. We give people stuff to make it go away, but I don't think we should be doing that. We should just allow the system to shake it out. So after childbirth, in some of the indigenous cultures, the woman, and you'll notice for those of you that have delivered and had babies, sometimes, or even if you come out of theatre at times, the system, the nervous system you start to shake, and it's the body's trying to regulate itself. And in some of the indigenous cultures, they actually call it, what do they call the second, or the, like it's a second or third birth or something like that, where kind of the whole delivery process has completed itself, the placenta, everything, and then the woman has her last kind of birth of tremoring, where the system kind of just shakes itself into regulation. So that's TRE, it's a tremor response. And sometimes people get a bit nervous when we talk about the body shaking. But my suggestion to you is that anything related to any of this, give yourself the gift of experience. Have the experience and then assess. Try not to come with oh, breathing doesn't work, or this doesn't. And for some people it doesn't. So if I'm extremely anxious, breathing makes me more anxious. It's not a good go-to for me if my nervous system is very dysregulated. Something else is better for me, and that's part of your journey. And that is where one wants to try and experience different things, because you will notice you really want a big tool bag that you can go to different things in different moments. So another kind of so breathing is a nervous system regulator, and it's more related to the deep breathing, the diaphragmatic breathing, the more conscious mindful breathing, even as simple as just coming into thinking of focusing on your breath and just quietening the mind and not letting all these thoughts go. So that's a combination now of a top down, so you're managing the mind and you're focusing on just breathing easily, effortlessly. And that is a beautiful nervous system regulator. Okay, it can be simple. It doesn't have to be complicated. You don't have to go and pay people money for it. It can be simple, but there may need to be a training process in it, because the breath is something that dysregulates. So there may need to be almost a period of training that goes with this, that you may need to do this every day a couple of times, that the body knows how to remember you are in the situation, because it doesn't know how to unhook, how to regulate. And there is a learning curve and a process that one needs to go through to almost give that learning period to the system. Okay, so kind of just doing breathing for 2 minutes and saying, oh, that doesn't work, that's not useful. Okay, and that's sometimes where we fail ourselves, because we don't know what we should be expecting from this. So the other things are kind of things like so we're talking about bottom up strategies, body strategies. So this is where exercise comes in, and again, this specifically needs to be looked at. What type of exercise? So for some people that are very much in a fight and flight response, find that if they go and do a solid run, that works for them. Okay, For other people, it's like, no, that makes me stressed. I need to go into yoga and it depends what you're trying to achieve again. So things like yogas, the Tai Chis, they combine a lot of things. There is mindfulness, there is slowing down, there is fascial work. Our fascia is very sensitive to the nervous system. So in those type of more stretch um, um, exercises, there will be various components that come in. There will be breath work, there will be mindfulness. And I encourage you to, if you're going to choose something like yoga or going for a walk, it doesn't have to be complicated. Bring in various components, combine things, bring in the top-down strategy. Stop worrying about your mother-in-law or whatever the case may be. Come into mindfulness. Look at the beautiful autumn trees. Connect, breathe, relax. Um, Bring a gratitude practice in. Thank you, thank you, thank you. It's a beautiful day. Visualizations, mindfulness. So you're bringing in a top-down strategy or a number of top-down strategies, and you're bringing in physical movement or stretch or yoga, and you're combining the two. And what will happen is you'll notice that as you maybe go into a stretch of pain in a yoga position, suddenly everything floods up and people often say, I don't know why I just started to cry in that yoga session, or I suddenly got so anxious. And it's like, yeah, you unlocked something and it flooded up that two-way street. So things like massage, fascial release, abdominal massage is wonderful for the vagus nerve. You also get vagal nerve stimulators. I know a few people that have used them. I personally haven't. Again, all of these, I love people to be able. I think they're great to bring in external stuff, even like a massage or whatever. But at the end of the day, I don't think in isolation, when the nervous system is very dysregulated, it completely regulates it. There has to be a process of mind body. Now one can understand really how that where that word comes from. That whole mind body approach to the well-being process. And that's where kind of a body approach would also be things like being mindful of a diet, or being, what type of foods you may be choosing, again, from a toxin aspect, from an inflammatory aspect. Let me just see if there's anything that but yeah, that's, so there are hundreds, they can be, and one can go into kind of energy healing work, one can go into more esoteric type of things, they can go into creative. So creativity is a wonderful nervous system regulator. Music, the arts, coloring, okay. So if you have a passion, your passion is one of the things that gets switched off when you are in a sympathetic nervous system state. So doing something that you love doing, that you're passionate about doing, and incorporating that into your days again. And, so all of that stuff. And those are the types of things that people are using for even like cancer treatments. They bring, creativity in, they bring the arts in, they bring music and dance and various things into that. But I'm going to stop there. I think we've got a good umbrella overview. And then if you want to, we can look at it a little bit more specifically, but then I'd love you to give me a little bit of direction as to what specifically you would like me to, because I can go into 100 different areas in this.
Sorry, just unmute. Yes, there's been a couple of people that have said that they would love for you to do a follow-up session. I think there is one question maybe that somebody has asked that's maybe just important to address. She or he wanted to know that I think it's a her, recently started seeing a pelvic physio, and unfortunately the treatment triggered PTSD. She's got a history of previous abuse. And now both her psychologist and psychiatrist is suggesting that she stop the treatment, the physio treatment, and the dilator use. and she's feeling really frustrated because she wants to move forward and feels that the pelvic treatment is actually essential for her marriage. So I think that's, yeah,
Okay,
quite a
so
difficult situation.
and I think this is an exact example of the complexity of things, and where we want to cut things off at the neck and going like, okay, don't touch the body if it's causing more problems, or like, don't talk about this if it's, it's, and really we are integrated. We are an integrated whole. And um so, and again, I don't know the full history, so I'm just, speaking kind of in a general context. Please bear that in mind. But this has been one of my great challenges working with the body, is that two-way street, and the 80 going up and the 20 coming down, can really flood the mental and emotional body when we touch the physical body. And it can bring up a whole lot of stored memories, traumas, experiences, and cause a huge level of dysregulation in the short term. Um, and and this needs to be managed carefully in a mind-body capacity, in the way that I see it. And I don't want to step on any toes, or I don't want to disregard or disrespect any kind of anyone involved in management of these types of conditions. But I think the thing with it is that there needs to be a careful weighing up of so no, we don't want to just bombard the physical body in a way that becomes traumatic. Okay, but when you've had a traumatic experience, and something opens up, or memories come up, stored memories that want to move through the system, that's also a healing process. Okay, so we open up to our healing from trauma, by allowing experiences and developing the tools to learn how to just be with what's come up, and what's moving through the system. But at the same time, if your kind of pump is this big, you don't want to be pushing this much experience through that tiny little pump. Okay, because you are going to malfunction. So there needs to be, the way that I see it is, there needs to be a very discerning approach to how much and how little. Would I run away from the body? No. I may step away for a little bit to allow what has come up, and to build on the tool set of dealing with what's come up, so that can be integrated properly, that it's not kind of sitting, because really post-traumatic stress is where we've separated aspects of our experience into almost little bubbles, and left them there to not look at. And then suddenly one of them, or something happens, and we go into a sorry, I'm just muting you, Hester, quickly. So what happens is that an experience will come through because it hasn't been healed yet. Okay, and there's no judgment to that. We all have these. And what happens is, and sometimes people feel, but not this again, and sometimes it's not this again, because we haven't completely got to the bottom of that experience, or we haven't developed the right tools, or what we did when it came up is we just pushed it away again, and then it's never going anywhere. So really, from a healing process, we want the integration to happen. And the way I personally would work from a mind body aspect is that I would discern the what is required for a healthy integration, and sometimes just stepping away from the body a little bit, or completely for a period of time while we discern, or changing it, that it's not such an intense bombardment. Maybe not doing dilators, but we can do something else, or and that can be discerned based on each person. So sometimes what I've done is I've stepped away from doing internal work completely, but I may have done fascial work in and around that area, because all the fascia still holds the memory, and the things can, and as kind of we've dealt with that, we can go deeper and deeper into the kind of deeper areas and the deeper emotional areas, okay? While we're developing the tools, and it could be mind tools, it can be body tools, it might be incorporating a TRE process, that we're giving the body an ability to process, okay, what has happened. But there needs to be almost a healthy communication between everyone involved in the process. And sometimes when one person's doing the body work and one person's doing the emotional work, it can seem like there needs to sometimes be a greater integration between the two people doing it, you know, yeah, I hope that's helpful. It's yeah. I would, as usual, we run over in this. I'm not very good with time, and I'm here to answer your questions and to really. So from a discussion aspect, I've completed my discussion, but I'd love to really take the time to answer your questions. So for those of you that have to go, I just want to thank you for being here. I'm going to stay on as long as we need to just get through the questions, because I want to give each of you the time to ask the questions. It doesn't matter how long we're here. If you were interested but you need to go now, you can always kind of watch the recording later and come back to this part of it. But for those of you that are going to kind of jump off, I just want to say to you that I have a variety of over the years, having seen the needs, like in an example like this, I do various types of things. So not only kind of are we doing the more physical physio type of work and the fascial work and that, but I, for instance, obviously I do the life coaching, I do TRE, but I also run a meditation on a Tuesday at 5 o'clock, and it's just a drop-in space. It's a space where you can co-regulate kind of with a calm nervous system. You can take time out of your day. It's free. The links are always in the newsletters. If you're not on my mailing list, please go onto my website, which is www.bettinamoser.co.za. Hester, maybe you can put it into the chat. And just subscribe to the newsletter if you are interested, but then kind of whatever's happening that month, and the links are there. I also run an online TRE group on a Thursday morning at 9 o'clock. Again, the details are in the newsletter. It is a scaled costing depending on what you can afford. The reason why I've done that is because I know many of us are spending extensive amount of time and money in various different modalities and treatments, and then it just gets too much to be doing all these things from a cost aspect. So what I've done is a sliding scale that whatever you can afford, you pay, and I send you a link and you join us. We do it on a video call, so you just put a mat on the floor, and we go through a gentle TRE process. If you want the experience and just try it out, and you don't want to have a private session, then that is a great way. And I generally suggest to do different things, a combination of different things, a combination of mind work, a combination of body work, and really it needs to be done on a daily basis. Just doing one TRE session here and there, or the odd meditation, there needs to be a daily almost practice around calming the system. And if in a situation like that, there's a lot of post-traumatic stress coming up, there are other modalities for calming the system, like what do they call it? The rapid eye movement therapies, hypnosis, to actually deal specifically with that that aspect of the trauma response, this post-traumatic stress response. The prices and all of that information, you can just touch base with me. So I'm going to give you my email as well. So my email is bettina@bettinamoser.co.za, or you can just go through the website, and I'm happy to kind of help you with any questions after this. But for those of you that are gonna leave us now, the other thing that I am doing, so I do have private coaching sessions, but I am doing a mentoring program, which is a 3-month more intensive program for people that are really dealing with something specific. So it doesn't have to be necessarily a body thing, like maybe some people are going through burnout or divorces, or it's more an emotional side. It can be emotional or physical, and I usually combine a combination of modalities, and that so there are a couple of entry points into what I'm offering on a mind body aspect. Hester is available to do kind of more physio and the fascial side of things. And, we can look at combining things, but there are a couple of things available. And I invite you to just make use of them, drop into those meditations and just experience it, see how you feel. And again, give yourself the gift of experience, try something and just see how you feel with it. But for those of you that are going, thank you for joining us. But as I say, we're going to stay here and we're going to go through the questions, and we can elaborate and give it to you in a more kind of day-to-day and practical aspect. Right. All right. What other questions were there, Hester?
Tina, there was a question about the freeze state and asking whether the freeze state is an exacerbation of the flight phase, or is it just an alternative option? Is it one or the other?
A freeze or fight or flight. Usually freeze is so it depends. So if the system thinks that fight or flight is not even an option, like I'm not gonna, let's say, I use extreme examples not to kind of stir people, but to just give give real life examples. So for instance, like in a rape, if the body mind complex or the nervous system, and it's not cognitive thinking, is assesses a situation and says, okay, you're never going to be able to run and you're not going to be able to fight, freeze. It's so quick that you're going through those layers. And this is where often rape victims have said to me, I don't know why I didn't scream. I don't know why I didn't fight. I don't know why I didn't. No. You were never going to. The system decided for you that that was not a very good option for you. Okay. So in these trauma states, the nervous system will decide for you. It's like when the cat catches the mouse and the mouse plays dead. Like it's not going to run anywhere. It's not going to fight it. Okay. It knows that. So it plays dead. It goes into that freeze state. So, but it is a deep trauma state that freeze in that trauma state. But what can happen is that you can have in a day-to-day nervous system dysregulation, you can have pockets of freeze. So like, let's say suddenly you have had a previous trauma that where your system has frozen. Let's continue the kind of rape discussion, and somebody who smells similar or looks similar suddenly walks past you, you can go into a state of freeze based on the memory pattern, okay? And you can have these pockets of freeze, or you can operate like, let's say you had a father that shouted a lot as a child and had was like, if you are in a kind of relationship where a person's doing that as an adult, you may naturally default into that free state because your nervous system almost just hooks into that state at those times. So it can happen even outside of trauma, where the system almost tags on. But that is an aspect of dysregulation. The system hasn't learned to come back into equilibrium, and that is the more post-traumatic stress or the recurrent episodes.
Thanks, Bettina. And then there was also a question on the apps that we, like the iPhones or the other Bluetooth gadgets, are using, where you can use that for relaxation or sleep. So does that in itself not also have an impact on the nervous system when you're using an iPhone?
Well, this is technology, and I think this is where one has to discern one's own body and our sensitivity. So if you know that you're a very reactive and sensitive person, again, I would try different things. So maybe initially or when you're very, very stressed, or in the learning process of meditation or calming the mind, you go to an app or that Insight Time is a wonderful meditation app for anyone who's looking for an app. But maybe once you've overcome the learning, and you almost remember that the body will remember that. So like almost when you go into a similar visualization or into a similar breath routine, the body will go, oh, I know this. Okay, just like in the negative, oh, I know that. Oh, I know this, and it automatically comes down. It's like a child hearing a mother's voice, like, oh, I know her, and I can relax. So you may find then after a while, maybe try not to use it, and actually at times go into it without using all the other extras. But again, these are giving yourself different experience. I think the most important thing is to just be mindful of it. Lighting, all of those things can affect your sleep as well.
Sorry, I just had to unmute. Yes, I think those were all the questions. There doesn't seem to be any more. I'm not sure if anybody else still wants to ask something. Somebody did ask whether the prices of your sessions are on the website, and I did put the website there in the chat for them, so they're welcome to go and have a look there to find the other information as well.
The other thing is the easiest is to just drop me as I said, the pricing varies depending on what it is that you're wanting. I don't put prices on the website because I change my stuff regularly based on what I think's working or not, or my time and what what I can offer. But just drop me an email and let me know what it is that you're struggling with, and I can also make a suggestion as to what I think would be the most beneficial thing for you, because sometimes one might not be ideal for you. There are times I've said to someone, look, I personally wouldn't go into a tremor like a TRE at this stage. I would rather do something different with you. And, I would want to maybe develop different tools before we go into something like TRE that might bring up a memory or post-traumatic stress or something like that. So I think just drop me a mail, give me a bit of your history, and we can take it from there. And I also do online. So if you're not in Joburg or whatever, we can, we can do whatever. We mustn't let these things limit us. Right, is that it?
I think that was a wonderful discussion, and I really think there's probably a lot more to talk about. And I do think there will probably be interest. People have indicated that they would like a little bit more. So yes, we look forward to the next one.
Okay, so then maybe what I'll do is let me give it some thought, and maybe what we can do is do it a little bit more experientially, so we can try a few different things. We can maybe do a little bit of let me think about it, and then we can maybe elaborate on the how-tos and the treatments and what type of how that looks, if that is of interest to you guys. And then we can, we'll take it from there. But I hope that really the intention of what I wanted to discuss today is really just to open your mind up to looking at things in a more integrative way, and really to understand how these systems work together. And really, when we start to look at healing, why combining certain things is so valuable in actually regulating the system and ultimately maintaining our well-being long term. So thank you very much. And Hester, thank you again for being here and for taking all the questions. And we will meet again at another time. Thank you.
Keep
And
well. Have a wonderful
good night.
evening.
Yes. Bye-bye.